You must be Michael. So I'm feeling a little fixation right here. The spine, the cervical, the thoracic, or lumbar. And this.
There's no one like Dr. Butt.
We're gonna give it a little bit here. Let me just check. Oh yeah, that's the way I like it.
Wow.
Hey, good day. My name is Dr. Michael Budincich. I'm a chiropractor. Thank you for tuning in today. I want to teach you a little bit today, some things regarding the feet, regarding posture. The word doctor itself comes from the Greek, which means teacher. So if your own personal doctor is not teaching you about the pains and prevention and the problems that you have, that's really a most important role for a doctor, is to be teaching how to not get things, or if you do get it, how to not get it again. So when people have foot problems, they can be from genetic causes, like you could have pronated feet, which is a correctable condition artificially with orthotics. You could have an anatomical short leg, which puts strain on one foot. You could have knock knees, which makes the foot angle at certain angles and cause problems there. Or you could have just a particular job that really puts a lot of strain on the arch of the foot, on the heel of the foot, such as climbing ladders, being on your feet on concrete all day. A lot of different problems that can occur from just activities. And typically the things that we see in the office are activity driven and postural driven. So being a teacher of chiropractic and not only a treatment of patients that have chiropractic problems, we've learned that many problems start in the feet. So even though we may be giving you adjustments on your lower back, if your feet are not balanced and corrected and you don't have orthotics or your leg length is uneven, you will continue to chronically get the same back problem or the back pain over and over again. So it's important that your doctor not only work you up for the problem with your spine if you're a chiropractic patient, but find out if the problem is coming from the base up. Just like if you were building a building, if you were a contractor, wouldn't you want a level concrete foundation with good footings dug down deep enough so it could handle the weight of the structure, whether it's 2 or 3 or 4 stories? Each depth of each footing, every contractor knows, has to be different for what kind of weight and pressure you're going to be putting on that particular building footing. So a person like myself that weighs over 260 pounds, I have a lot more pressure and weight on my foot than, let's say, an average person. FAA person for an airplane, for instance, is 170 pounds. That's your average person that flies. So that's how they calculate the seats and everything else. But of course, I'm not average, and a person that maybe is 95 pounds is not average. They're on the light average. So mechanics is different. So we have, as a doctor, we have to take every person's posture and individual case into consideration because everybody's not different. So when we analyze a person chiropractically, we look at their posture. Are their hips level? Are their shoulders level? Is their spine straight? Do they have a scoliosis? Is there a problem with their spine being affected by their feet? Is the foot flat on one side or on both sides? Or are the arches normal or not? Are the foot turned in or pronated? These are all things we have to look at. We watch a patient walk typically and look at their gait and whether the foot toes out on one side or the other. These are all little nuances that a doctor can pick up as to what kind of mechanics are going on that will cause a particular set of symptoms, or a hip pain or a knee pain or a combination of a back hip. So just by getting rid of a pain, which is probably the simplest thing to do for a doctor, is to put treatment on an area, adjust an area, put therapy on an area to get rid of that pain. What's going to keep the problem from returning? What can you do mechanically, structurally, balancing wise that will actually make the person's life better after you treat them, so that they don't have to keep coming back for the same issue and over again because you haven't actually found the core base problem. So one of the things that we focus in on at the Budincich Chiropractic Clinic is finding the cause of the problem. Because frankly, there's a lot of good chiropractors out there that can actually help you with your pain. But if the pain keeps returning, perhaps your chiropractor is not getting to the source of the problem. So those are some of the things that we like to focus on. Is balance of both the feet, the hips, and the spine, because the way you walk, stand, has a tremendous effect on the way that your spine feels, and also how your feet feel. Your feet is the foundation of the body. So if the arches are not supported based on your weight and based on your job, if your shoes are not correct, that's going to also cause problems. There's a lot of inexpensive, lousy shoes, to be quite honest, that are being manufactured today. If your shoes are really inexpensive, they're going to wear out very quickly. A lot of these shoes they make today out of rubber have air pockets in them. And as soon as you wear through that air pocket, the air leaks out, it caves in on that side, and it starts to affect your posture. I'm not going to mention any names, but if you spent probably less than $50 or $60 for a pair of sneakers, they're probably cheap. I will mention that probably the best sneaker or running shoe made right now is probably a New Balance, which your high level runners are going to be wearing. And there's several other good brands too, but because I'm from the United States and New Balance is made here, I like to push New Balance. If it's a walking shoe or a comfort shoe, I really like San Antonio shoes, SAS. They're kind of ugly, but I'm telling you, these shoes are the best shoes made. They're structurally very supportive, and if you're an older person that has had foot pain and you get into a pair of SAS shoes, ugly or not, you're going to want to wear them. As far as a sandal, if you're wearing just a typical, surfer sandal or whatever, pretty much one's going to be as good as the other one, and you're going to have your own particular style. But if you really want to have something supportive, those German ones that have the cork soles are very, very good, and they've been making those since the hippie days, and you know which ones I'm talking about. But they're excellent. They have a lot of knockoffs of that brand too. Birkenstock is the name, and Birkenstock knockoffs are also tend to be pretty good. They have a cork sole, he supports your arch, and the nice thing about a Birkenstock is that the sole is completely flat, so if you have an anatomical short leg, one leg that's actually longer than the other, you can add a whole layer to the bottom of one to actually bring that shoe up, and then it levels your hips. So if you're going to wear sandals, it's probably the best shoe to buy for a sandal, for both the arch and for the aspect of leveling your pelvis. So there's so many conditions that branch off of having a bad gait or flat feet or an uneven leg length, so many of the pains that we see. So as we work up a patient, it's very, very important that we check all these things. The feet are very critical to the posture, and then if everything is balanced, it's so much easier to keep the spine in shape when it's balanced from the bottom up. Thank you very much.